All right, so I forgot to assign one of you guys urine analysis. So I guess I'll do it. So I chose to do a video because I thought that would be the best way to show you guys how to do everything. So let's remember how to take a urine sample and how to read it and interpret it. So the first thing we're going to do is obviously I have some, uh, practice urine, I guess. So the first thing you would do is you'd instruct your patient to go take the cup, go into the bathroom, urinate in the cup. You have about like that much, all right, because you want enough to go ahead and dip the strip in. And then you'll go ahead and have them come back and they'll give it to you. So before I touch it, all right, I want to make sure I go ahead and put some gloves on. Because we want to make sure that we're using our universal precautions. And then you want to make sure that you go ahead and, kind of create a, somewhat sterile, environment for the test strip, right? So we want to make sure that we take some maybe gauze and lay some stuff down because we're going to have to let the strip kind of sit on something, right, before we go ahead and kind of read it. I also like to kind of maybe lay a few down to put the urine cup on, just in case you have a couple of spills, right? We don't want to get urine everywhere. So we can go ahead and kind of just lay some down for that too, so we can keep our little cup on that, all right? And then this is where we'll go ahead and put our strip. So I'll move that back so you guys can see it better in the video. All right, and then I want to make sure that I go ahead and pull out a urine strip. So make sure that you pull out the urine strip before we go ahead and touch the urine itself because you got to go in and grab one, all right? So you don't want that, okay? And then don't forget we want to go ahead and keep this bottle handy because the bottle is going to be how we're going to go ahead and kind of read and interpret everything. So I'm going to take the lid off of the urine. And then I'm going to go ahead and dip the test strip in it. Make sure that you guys can see the test strip, all the different colors. Make sure that you get the whole entire test strip in there, all right? So I'm going to go ahead and dip it. I want to make sure that all levels of it get, absorbed and make sure that they touch the urine, right? And as soon as that's done, go ahead and kind of like tap it off on the side. And you can go ahead and lay it down and let it sit. And then what I like to do is I like to go ahead and cover the urine, right? Because just in case, like, if you knock it and hit it, right, then it spills everywhere. So I like to put the lid back on top, nice and tight, all right? So then we need to go ahead and kind of let our test strip sit. So if you guys remember looking at the bottle, right here on the side, depending on what you're testing for, see like the glucogen, it'll give you the seconds and how long. So leukocytes is the longest one. It's 120 seconds. So usually we want to wait about 2 minutes. So I'll just wait for 2 minutes to hit on my clock on my computer. And then we'll go ahead and take a look and a reading. So in the meantime, we can talk about the urine strips in general. So keep in mind reasons that you'll go ahead and you'll test urine. Yes, we do it for drug testing, but this is a different type. So you'll be looking for hydration level. If there's any glucose in their urine, that could be a sign of diabetes or something like that. If there's issue with protein. You also look for ketones, which could be associated with diabetes as well. Leukocytes would be a sign of infection because those are white blood cells. So there's a variety you can look for. For you guys, as of right now, you just need to focus on this is not normal as far as reading the strip. This isn't normal. We need to refer them to a doctor. You don't need to worry about the very specifics of what they mean. You'll learn more about that in advanced physical assessment your junior year. So right now, just focus on being able to read the strip properly and then interpret if they need to be referred or not. And we'll go through that. We got like 1 more minute left. Just going to kind of tap it off on the side because it's running a little bit. But we'll wait 1 more minute just to be sure. So yeah, how's it going? Pretty good. Hope everyone's first week of school got underway well. We're in the second week. Hopefully things are doing okay. Things are good here. Had a good weekend. This is getting really boring. But we have to wait for our urine strip. And we're done. Awesome. Okay, so let's go ahead and take our strip. And it might be a little hard for us to read it because I'm going to have to like face the computer. All right, but I'm going to try my best. So remember, we're going to use our scale, right? So again, cap my strip off just to make sure that we don't get any excess, all right? And so you're going to want to go ahead and compare it, all right? So as you can see, I'm going to try to get really close, all right? So as you can see, what's that? Urobilinogen is the first one. So go ahead and rotate it, to look at the scale. It's still pretty white, so we'd say that that's normal. Oh, if we go to the next one, it is brown, where it says glucose. If we go all the way, that's to the far side. It's like 1.0. That is not normal, all right? So there's something wrong with their glucose. They need to go ahead and get referred. If we look at the next one, ketone, it's kind of tan. Notice, is it turning purple? Not really. So if it's not really turning towards purple, you're probably near that negative or trace. I'm just going to set it down so I can get a re-grip because I kind of have to hold it awkwardly, all right? All right, and then, come back. So then if we go down to bilirubin again, all right, it's kind of got some pink around it, but, sometimes that can be like a false positive. But if you look at the main color, right, if we look at the bilirubin, as we turn, it's starting to become blush. And it's really not quite becoming that color. So you'd probably say it's probably still negative. Also, that drippage could be off of the brown from the top, so you want to look at that. The next one is protein, right? So we can see our protein. Looks pretty yellow. It's not turning green, so we're not going to follow it, so that's negative. And then we have, what's next? Then we have nitrate, all right? And so if we look at our nitrate, well, it's still pretty tan. And then we have leukocytes, right? And if we go ahead, then we have leukocytes, yep. So if we follow our leukocytes, they're pretty white, right? They don't start turning purple, so we're pretty good there. Blood is yellow, right? And we're not getting any specks and it's not turning green, so that's nice and good. Our pH is orange. And we're not turning green or blue, so we're pretty good there. And then our specific gravity is kind of a green, right? So it's maybe not quite that blue, but it's probably maybe around there, right? So that would be a 1.005. So usually for most of these cases, put the strip down. If you're within something that says normal or trace, as far as the labelings on here, like normal, trace, or negative, you're kind of good. Like you really don't need to be referred. But if we start getting into the areas that are past normal, negative, or trace, that's going to when you want to start referring. So usually I'll say once we start getting into like the third row of anything and kind of forward, if you're kind of in those first two rows, you're probably okay. All right, but as we go ahead and kind of moving forward. So if it's not negative trace or, normal, you might want to consider them going ahead and being referred. All right, hope you enjoyed the video. Make sure you drink lots of water. Bye.